You're about to learn the head-to-toe assessment, your first real superpower in healthcare. This isn't just a checklist, it's a systematic conversation with your patient's body. Think of yourself as a clinical detective, picking up clues that tell a story about your patient's health. Use your senses, sight, touch, hearing, to gather information no machine can fully capture. Don't let the steps intimidate you. With practice, this becomes second nature. Today, focus on understanding the why behind each step. Every action has a purpose rooted in patient safety. We'll break down the process from head to toe, so you'll feel confident and prepared. Every expert started as a beginner. Be methodical, present, and curious. Ask questions of your patient and yourself. What does this finding mean? What else should I look for? Grab your stethoscope, pen light, and notebook. Let's transform you from a student into a clinician who truly understands patients. Ready? Let's dive in. Your assessment starts the moment you enter the room. Observe your patient's general appearance, hygiene, level of consciousness, and speech. These first impressions provide a crucial baseline. Next, measure vital signs: temperature, pulse, respiration rate, blood pressure, and oxygen saturation. Don't just record numbers, interpret them. For example, a fever may signal infection. Low oxygen saturation is an emergency. Use the correct equipment and technique, like the right blood pressure cuff size and counting irregular pulses for a full minute. Take your time. Accuracy matters. Document findings clearly and report abnormalities immediately. Remember, vital signs are more than a task. They're a window into your patient's health. Your attention to detail here can make all the difference. Let's move on to the hands-on assessment. Start at the head, palpate the skull for lumps or tenderness, and inspect the hair and scalp for lesions or hair loss. Assess facial symmetry. Drooping could signal a stroke. Move to the eyes, check for symmetry, inspect sclera for color, and use your pen light to assess pupils. PERRLA, pupils equal, round, reactive to light and accommodation. These checks reveal neurological and systemic health. For the ears, look for redness, swelling, or drainage, and ask about hearing changes or ringing. Perform a simple whisper test for hearing. Inspect the nose for symmetry and discharge. Use a pen light to check for swelling or redness. For the mouth and throat, look at teeth, gums, tongue, and mucous membranes should be pink and moist. Dryness or lesions can indicate dehydration or infection. Check the back of the throat for redness or white patches. A thorough ENT assessment can reveal infections, dehydration, and nutrition issues. Be systematic and efficient. Now, let's move to the neck and chest. Observe the neck for symmetry, swelling, or visible pulsations. Palpate lymph nodes. Swelling or tenderness may signal infection. Ensure the trachea is midline. Deviation can indicate serious lung issues. Watch the patient breathe. Note ease use of accessory muscles and chest symmetry. Unequal expansion or labored breathing are red flags. Auscultate the lungs front, back, and sides. Compare both sides at each level. Listen for normal breath sounds. Note any crackles, wheezes, or raunchy. Always place your stethoscope on bare skin for accuracy. Document findings. Specifically describe abnormal sounds and their locations. These details guide diagnosis and treatment. Don't rush. Your careful assessment can catch early signs of distress. Let's continue with the cardiovascular system. Ready? Inspect the chest for visible pulsations or heaves. Check extremities for cyanosis, swelling, or slow capillary refill. Press a nail bed. Color should return in under 3 seconds. Palpate the apical pulse at the 5th intercostal space, mid-clavicular line. Assess peripheral pulses, radial carotid, one side at a time, and pedal. Compare both sides for strength. Auscultate 4 heart areas: aortic, pulmonic, tricuspid, and mitral. Listen for S1 and S2, lub-dub, and note any murmurs or extra sounds. Document heart rate, rhythm, and any abnormal findings. Describe murmurs by location, timing, and loudness. Connect findings. Weak pulses, leg swelling, and lung crackles may indicate heart failure. Your assessment helps guide timely care. Be thorough and precise. Now, on to the abdomen. Inspect the abdomen's contour. Flat, rounded, or distended. Check for scars or rashes. Auscultate before touching. Listen in all 4 quadrants for bowel sounds: active, hyperactive, hypoactive, or absent. Absence of sounds after 5 minutes is serious. Could mean bowel obstruction. Percus for tympany, air, or dullness, solid organs or fluid. Palpate gently for tenderness, masses, or muscle guarding. Ask about urinary habits, pain, frequency, hesitancy. For catheterized patients, assess urine color, clarity, and amount. Clear, pale yellow urine is normal. Dark or bloody urine needs reporting. GI and GU assessments monitor nutrition, hydration, and organ function. Early detection of problems is key. Be systematic and gentle. Document all findings. Let's move to the musculoskeletal and neurological systems. Inspect posture, alignment, and muscle symmetry. Look for joint swelling, redness, or deformity. Ask the patient to move major joints: shoulders, elbows, wrists, hips, knees, ankles. Note pain or limitations. Test muscle strength. Have the patient push, pull, and grip. Compare both sides. Grade strength on a scale of 0 to 5. For neuro, check level of consciousness, PERRLA, and speech. Test sensation. Sharp, dull touch on arms and legs. Assess coordination. Thumb to finger test, observe gait. Note any weakness, limited motion, or unsteady gait. Document precisely. For example, 3/5 strength left leg, unsteady gait, needs assistance. These findings guide safety measures and care plans. Now let's tie it all together. You've completed a full head-to-toe assessment. Each step builds a clear picture of your patient's health. Be systematic, present, and thorough. Don't skip steps. Always explain what you're doing to your patient. It builds trust. Document everything. If it's not documented, it didn't happen. Your notes are vital for the healthcare team and patient safety. With practice, you'll spot subtle changes and grow more confident. Ask for help when unsure. Safety comes first. Your commitment to learning makes you exceptional. The head-to-toe assessment is both art and science. Use your skills to connect, think critically, and make a difference. You've got this. Go be the clinical detective you're meant to be.